The essential health benefits are a provision in the Affordable Care Act that specifies 10 categories of benefits and instructs the Secretary of HHS to then fill in the details, if you will.
There's 10 categories that include hospitalization, doctor visits are included, as well as maternity care, mental health services, pediatric services. They were services that were determined by the Congress to be essential services that are needed to provide a comprehensive set of benefits.
Keep in mind that when we look at the essential health benefits, states have regulated insurance for over 100 years, and in the case of health insurance have mandated benefits to one degree or another, required them. The problem with the federal government doing that is that you have uniformity, but that also means that you're stuck with that. You don't have the option of experimenting with changing it. It literally takes an act of Congress to change it.
Covering essential health benefits in insurance plans is very important. Before we had the essential health benefits, we had situations where almost 40% of people enrolled in the individual market didn't have maternity coverage because it wasn't required. And in states such as Colorado, no plans even offered it as an option. And so without requiring the essential health benefits and having it, you end up with really a patchwork insurance system that covers some needs, but not nearly close to the comprehensive medical needs that the essential health benefits require.
If you have a minimum federal floor, then the floor tends to go up and up and up over time. And I think empirically we've seen that the system has worked pretty well without that for quite a long period of time. And in fact, in past legislation, Congress was careful to avoid the thorny briar patch of benefit setting. So, for example, in the 1996 Health Insurance Portability and Accountability legislation, HIPAA, what Congress did is they avoided specifying what the rules applied to as a package that looks like A, B, C, and D. Instead, they said they apply to health insurance except for things that really aren't health insurance. And so they defined health insurance not by what it was as a minimum floor, but rather by anything other than these things, what it wasn't. So, having a medical liability on your auto insurance, that's not health insurance. Having a single disease policy, that's not health insurance. So Congress was actually pretty smart about how they did this in '96, and this is the opposite. Essentially, in the Republican efforts, legislative efforts, the American Health Care Act or something else like that, the Republicans are looking to turn back to the states the authority to decide benefits and to get the federal government out of deciding benefits, or at least that's certainly what a lot of Republicans would like to do. It is a bit of a sticking point with some. While it's not different substantively from what states do, this is an area where I think it would be better for states to have the flexibility to decide on their own what works best. And it's more likely to change, and you're more likely, you move to another state, just like state tax rates, you move to another state, you can at least, get out from under what you don't like. There's always an issue when you're doing benefit mandates or at either the federal or state level, because there's a trade-off between the access that they may provide to some people and the costs that they impose, particularly on other people. And so the focus now is on the cost side of the equation, because they have been one of the significant drivers of the increased costs we've seen over the last couple of years in the individual market. They're not the only driver, but they're one of the significant drivers.
Rolling back the essential health benefits will overall really have a detrimental effect on people with healthcare needs and people looking to buy coverage in the individual and small group market. There might be a reduction of premiums, but what you get for that is coverage that covers a lot less. And in addition to the fact that these benefits are required to be covered, you also have cost-sharing protections that are part of the essential health benefits. Right now, because of the Affordable Care Act, if you have a $50,000, $100,000 cost, that amount that you have to pay towards that is capped because of the essential health benefits. And in addition, the insurance company can't say, well, we're only going to pay $1 million in claims during your lifetime, which is something that happened very commonly beforehand and really caught a lot of families whose children were born with congenital diseases in very difficult circumstances where a child would run out of insurance in the first couple years of life. The other piece is that people won't have coverage for the services they need. A woman may have, roll back, a woman may have to pay for the full cost of her maternity. Somebody who is looking for services to treat an opioid use disorder or other substance use disorder may go without those services because they aren't going to be covered by plans. And if they are covered, they will be extraordinarily expensive because the insurance company knows the only people who will buy maternity coverage, who will buy mental health or substance use services, are those who expect to use those services.